So
Awesome.
thankful for you guys all to be hanging out with us tonight. I know nighttime is sometimes your time to relax, or if you're actually on shift, thank you for using your break to hang out with us.
Yeah, we're excited for everyone to be here tonight, especially during National Vet Tech Week. We purposely partnered with EVT because they're always empowering their veterinary teams, as their title of their company explains. And Alyssa is a vet tech herself, so she has been in your shoes. And we wanted to celebrate Vet Tech Week, not only within our own community, but also within the profession, because vet techs are extremely dedicated, passionate people, and that comes through in their work every day. So we wanted to celebrate by talking about triaging.
It is definitely something that our vet techs within our hospitals experience more often on a daily basis than what we probably can even imagine. So thank you to all of our vet techs and our veterinarians out there for everything that they do within the hospitals.
Absolutely. We have a t-shirt that we're actually going to be giving away this week on our platforms. It says you can't spell vet without VT.
It's true. Yes.
Very
And
clever.
the really great veterinarians out there know how important their vet techs are.
They do.
They absolutely do. So I will just talk for just a few moments, and I'll pass it off to you, Alyssa, because I know we have a great program tonight. For those of you who don't know me, I want to thank Carly, who is our host every month, if not more than once a month, for our community veterinary partners of VetFuel series. We partner with great people like Alyssa and Caitlin on delivering great content. And the purpose of our VetFuel is really to be able to engage in things that are important to the profession. So I want to thank you guys for being here tonight. Community veterinary partners, we are a community of animal hospitals, and we like to say we're more than a community of animal hospitals, we're a community of veterinary care providers. So we are celebrating Vet Tech Week. We're celebrating Vet Tech Week not only in our hospitals, but across the profession. So we're happy to have Alyssa here with us tonight and Caitlin to talk about triage. So I will let Carly, I don't know if there's anything else that we need to tell them from a logistical standpoint. Oh, the housekeeping items.
Yeah.
Of course.
Yeah, it's
all right.
pretty simple.
I will you handle that, Carly. So
okay,
thank you.
Sounds good. What we want you to know is you are allowed and encouraged to ask questions, and there's two ways that you can do that. The first way and the easiest way is through the chat function of Zoom. And the other way is if you would like to email your question in, you can do that to askcvp@cvpcode.com. And there is some instructions on the screen. If you're able to change your Zoom name to your full first and last name, it helps EVT with CE collection and sending. So that will really be helpful with who was here and being able to keep track of that. And that's really it. Housekeeping is pretty simple.
Yeah, we're pretty low maintenance, which is good because we're going to be talking about stuff that isn't. So, all right, without further ado, because I know time is precious and it's the one resource we don't have a lot of, let's get into it. So EVTriage, we love to play with our acronym and take EVT and add anything on there afterwards, you know, EV time, things like that. So I am a CVT. I've been in vet med since 2004, credentialed since 2012, and spent the majority of my career, the past 10 years in particular, in emergency and specialty. So I've lived it. And I know all of you, even if you're not in the ER officially, it's COVID time, right? We're still in it. So everyone's doing urgent care and emergency work, regardless of what the name on your hospital says. So what we're going to talk about tonight is a lot of stuff, and some of it may be review for some of you, but a refresher is never a bad thing. And if it's new for you, Caitlin's going to be moderating the chat for us, and we're going to run through a bunch of scenarios as well, so we get a flavor of what this feels like. So I'm going to talk about when to go to the ER and what you're looking at when you're coming into that situation. When stuff gets real, when you really need to pay attention and get your docs involved. So if there are any veterinarians on the session tonight, welcome, but this is pretty much geared to our vet techs and vet assistants. They're going to be doing the majority of the triaging process. and talking about how we get ourselves prepped for that and who does what in the role, and talking a little bit about that new thing that maybe you do, maybe you don't, called teletriage. And if it's not a term that you're familiar with, well, welcome to it. It's a lot of fun. And really how we can make this work is being efficient. Then you get to get a good sampling of what it's like. I'm going to play, we're going to play some roles here. Caitlin's going to jump in and yell at me a little bit and see how I handle that. So hang in there till the end. It's going to be fun. Those of you that are familiar with the Recover Initiative and CPR, we're going to review that just a tiny little bit, just because this comes into play definitely in emergent cases. And then we're going to do our best to reserve some time at the end for some questions and comments, but we'll also make sure to throw a slide up there with our contact info should anything else come up that you want to ask us directly. So when do we go to the ER? Well, really, if you're not very familiar with the emergency process, think of it when you would go to the ER, right? If you are not mentally appropriate, if you are not able to respond to stimuli, that's what those two things are talking about in that first bullet. So my favorite acronym, not because it's a good thing to see, but because it's kind of fun to say, is ADR, ain't doing right. And that's typically what we throw at things, you know, like when we send them to internal medicine. If we can't figure it out, IM can do it. But ADR is really when they come in and they're dumpy, and we have to do a bunch of things to figure out what's going on. But we ask our clients, and we're going to go through that too, the question process, what is going on with them? Well, they're just not acting right. I need a little bit more info than that, right? D&D, not Dungeons and Dragons, all my fellow nerds out there, but this is dull and depressed, right? So this is where you head before you get to obtunded. And it's making sure you can actually rouse that patient, right? When you're talking to your clients, like, can you wake them up? You know, there's a difference between sleeping, lethargy, and just completely unresponsive. Respiratory distress. Cats should never open mouth breathe, ever. So if you ever see that happening, if their clients calling in a panic, that definitely needs to be seen right away. And that can stem from a number of conditions. Those are two I've listed there. Asthma, and if you have a pneumothorax. Had a case where a pup tried to clear a fence and missed. So that was, I mean, when you have half of the fence sticking out of your chest cavity, it kind of indicates that you should be seen by a professional. Bleeding and fractures. Sometimes you can see it and sometimes you cannot, right? So we have to make sure that when we are talking to people on the phone or they come in for that initial exam, what are you looking for, right? If you see swelling, if there's, you know, little bruises, if there's little pinpricks of blood versus there's a bone sticking out of their leg. Neurologic events, seizures. These are never a good thing to see. They are always terrifying and traumatizing for owners. And honestly, if it's a really bad one, it can be upsetting for us. I had a personal, my pup passed away a year ago after having 5 grand mals back to back to back. And even with my training, that took a lot. It took a lot out of me. So it can be really scary. So if it's the first one, we're going to go into a little bit more detail, but if it's the first one, or if they've had more than 3 in 24 hours, get in, no matter what the age, right? Our down dogs, the most common offender of this, dachshunds, right? So anything that's long and short-legged tends to not have a good back. You need to make sure that you're talking to them about pain response and what it looks like. Are they moving their front legs, or their back legs are not at all? Are they able, if you push on them, to have a pain response? You should do that. Don't have a client pinch their dog's toes. Bite wounds are not a good thing, because then they're going to the human ER and we don't deal with people, right? Trauma, more acronyms, because vet med, hit by car. And another good acronym favorite of mine, LDBD, little dog, big dog. It's the little guys that always start the problem, but then they get the worst of it, right? So puncture wounds and things like that. GI. I mean, once you've smelled parvo, you never forget that smell. Same kind of thing with HGE, the hematochezia, that it sticks in the sinuses, and it's definitely not something that's pleasant, and it's not pleasant for the patient either. And then you have those acute conditions that come on pretty suddenly. So acute renal failure, or actually more appropriately called now AKI, acute kidney injury, is, you know, something, especially we see that around what holiday? Easter, those lilies. Never, never, never have lilies around cats. You all know that, but make sure that your friends and family do too. Any other toxic things that they get into, especially the ones that the owner's like, there's no way they could have gotten into. Exactly. And then the condition that I'm not even going to say out loud, even though I'm nowhere near a hospital ER, just superstitious. I'm not going to say it. Not even the B word that goes with the acronym that's there. Definitely something to be on the lookout for. And one of the strangest patients I had that was a 7-month-old dachshund. can happen in any size, even though it's typically the giant breed barrel chested. And then you've got your chronic flare-ups, right? So diabetic patients that go into a DKA crisis, if you have an Addisonian flare or congestive heart failure. So these are all things that there's more details that we could go into, and we will a little bit, but that's going to take us, it could take us a whole week. I'm talking about which each of these cases are, but really keep these things in mind. And there's always going to be more, right? So I'm sure all of you can throw something in the chat that you've seen or experienced that, shouldn't this go in? Yeah. Bottom line is, when you are talking to one of your clients, whether it's face-to-face or on the phone, if they are concerned and it's something that they feel cannot wait, then they have the option to go to the ER. Please warn them, wait times are still very long. And if it's not life-threatening, that the team members at that practice will assess them and go from there, but they always have the option to be seen. This is some of these items here are when you really start to get concerned, when you start seeing them, right? So when they come in after any of those conditions and you're seeing these things, right? So we don't want them to be too cold and we don't want them to get too hot. And when we're thinking hyperthermia, another one of my favorite terms that goes along with that is pyrexic, right? And how can you remember that one? Think of Pyrex dishes when you heat them up in the microwave. Yes, I'm dating myself, okay? My mom had a lovely set with the white and the blue flowers, and some of you may remember some of those. But pyrexic is anything over 104, right? Really high fever. So we're talking heat stroke, right? And that's definitely something that you want to intervene with ASAP. Same thing with hypothermia. But the trick here is you don't want to do it too quickly, right? You don't want to cool down a patient too fast, and you don't want to warm them up too quickly. So then you get reperfusion injury and you're dealing with a whole other set of complications. So the key thing here is when you have a temperature control issue, control the getting back to normal. Hypotension, low blood pressure. I suffer from this. You know, I stand up too fast. I'm like, whoa, not typically a condition that you see with our four-legged pals, but that's okay. What you're looking for here is you're feeling their pulses. And where are our main pulse points? Our femoral artery, right? You can get on the carpal one, it's the lower portion of the brachial artery. And if it's a skinny patient or a cat, you can do it right on their heart, okay? But what you really want to think about is, what does it feel like when it's hitting your finger? The two fingers you want to kind of avoid using are going to be your thumb and even your middle finger and your index finger. They're not as sensitive, and your thumb has its own pulse. So the best two fingers to use are going to be your ring finger and your middle finger. It's going to be size dependent where you feel it, and you got to make sure you know what your rates are, right? And think about too, which limb you're using. And should you always have one of these handy when you're feeling? Stethoscope? Yes, please. So you can notice if there's any arrhythmias. And that goes right into that next cardiac and circulatory bullet point there. So mucous membranes. Now, if they're snarling and snapping at you, they're not necessarily critical, right? So we can get a good look at their gum color without getting ourselves into a bit of a tricky situation. You can also be like, they're going to be fine, unless they're in a different version of shock. And we'll talk about that in a minute. But what you're looking for here is if it's any other color but pink. And now what happens if it's a chow or a black lab and they have pigmented gums? Other mucous membranes, right? Look at the conjunctiva, the pinna, prepuce, or the vulva, and even the toe webbing that can give you a little bit more of an indicator. Toe webbing is not going to be great on a dark furred or a dark skinned critter, but you can definitely look at the genital regions and get something from the conjunctiva as well. Syncope, that's a fun one. You ever had, a Doberman just walking, all of a sudden go, Phoom! Yeah, that's fainting in a dog. Terrifying for the owner. Not something that's uncommon, but again, you've got to be careful when we're talking about these things and assessing them and then going back to the owner with the information. We know a lot more than they do, right? And that's our own knowledge bias. So we have to make sure that when we talk to them, and we'll get through that in a little bit, that we're not oversharing to the point of they're like overwhelmed and can't handle it, but also that we're relaying to them exactly what's going on. Respiratory things that we're really concerned about. Cyanosis. That goes in with your blue gums, absolutely. But blue gums shouldn't be blue. They shouldn't be purple. And they shouldn't be gray. They shouldn't be yellow. They should be pink, right? So when you're seeing that color, you're immediately checking a pulse ox. You're immediately assessing the lungs, listening to them, all four lung fields, and making sure that they're not having an incredibly difficult time breathing. That's your dyspnea, right? If you're not familiar with that term, a dyspneic patient is no bueno. So this can also go in conjunction with a cardiac issue, right? You have a patient that's in heart failure, Cavalier King Charles. Make sure that you're understanding that when you have a heart that's not able to pump correctly and there's fluid in the chest, your respiratory function is going to be depressed as well. So really understanding how all of these body systems intertwine and they're going to show and manifest in similar ways is really important coming from the backside with the medical team. Neurologic events. And this can be, yes, our most common are going to be your down or your seizure patients. And that's where I list there what I just mentioned about the first seizure or greater than 3 in 24 hours. But there's other things, right? If you have vestibular disease where the patient's just spinning and they got the head tilt. What if you're having some other types of instability in the head, like Chiari malformation or an AA lux? If you have a bobblehead chihuahua, that's not cute, right? That can be really, really concerning and you need to get it stabilized right away. So the list can literally go on and on and on. But what I'm really trying to talk to you about here is you want to identify the most critical piece that's affecting that patient at that point in time. So can you do this on the phone? Most of it.
Auto resolve not only helps to keep an onion.
That was fun. I think we were getting a little bit of a recipe there, which can, salt's actually not a bad thing. That sometimes we do that in IV fluids too. We'll talk about that momentarily. But really, what I want you to be aware of is these main things, right? Make sure their temperature is normal or we get it normal. We're looking for their blood pressure, their circulation, making sure they're breathing okay, and that they're neurologically stable. These things we need to get assessed and get stabilized before we can go further. But you've got to be ready for this too, right? So if you've never worked in the ER before, like a full-on, let's do this, we're working from 2 to 2. That was my shift. I was a swing shift. Actually really liked that because I had my morning and then get home at 2 and I could sleep for a decent amount of time until the young humans arrived, and then it got a little bit trickier. I digress. But really, before you're heading into any of these situations, you need to have sometimes a physical checklist, but definitely something to keep you going, right? So you want to approach every patient the same way every time, right? You want to start it off with, what are the questions I'm going to ask? How am I going to approach the patient? How am I going to talk to the client? Don't let it spiral you, because you're going to remember to breathe, which I almost forgot to do. And you got to drink some water. Because as much as we don't want to talk about the fact that we deal with humans every day, because we got in this to be with animals and to save their lives, every patient comes with an owner, and we work with a bunch of other humans, most of whom we really like. So we need to be able to have those types of conversations, and we can't take care of our patients if we don't take care of ourselves first. So you need to do a self-check and be like, okay, stethoscope, pen, gloves, what else do you need, right? What is your standard operating procedure when you go in for a triage? How do you approach it? What is your practices, things that you follow on all the time, and make sure that it's all taken care of appropriately.
So our
Make
spices
sure
are ready.
that when you are listening to your clients, that you're listening actively, right? You don't want to be thinking and formulating your response 3 steps ahead. You want to be present in the situation, because you could miss something, right? And if you don't then write that down, it didn't happen. How do you gain confidence? You keep doing it, right? It's like a muscle, right? You've got to create that memory, and you do that repetition and to get better at it. And we're going to practice with you tonight, right? This is something that you have to just do it. It's not a sink or swim. You definitely need to practice it before you get in there, but it's something that's going to get better every time you do it. You do have to be quick. You need to assess your patients within 30 seconds and get them in the back, especially if you need to start CPR, but that doesn't mean you're rushing. There's a method to the madness, literally, right? I'm assessing my CBAs, right? Circulation, breathing, airway, and making sure that the client has given us permission to do what we need to do. And then they talk to the CSRs and we go. And you have all your stuff ready. You've got the triage form, either digital on an iPad that you hand to them. Maybe some practices have that. That's on my wish list. And then you have your patient record pulled up. You've looked at it before, or you're creating one because it's a walk-in. And what else do you need? Depends on the situation, right? If it's a known isolation case, you better have your PPE on, right? And definitely include the bouffant for your hair, because some of that stuff is airborne. So let's talk about the process and who's involved. CSRs get the phone call, vet techs get the patient, doctor does the initial eval, right? Sometimes, and sometimes it gets a little bit different, right? These lines can blur. And especially in the past few years, dealing with, intra-COVID, and I guess we're post-COVID, although I hear there's another surge coming. I didn't say it out loud. You didn't hear it from me. But knowing that, you have particular people that do a particular role within the practice can really save you time, effort, and energy. So let's take a look at what that can be. My CSRs. I have sat in that seat. It is really hard. Thank you for all that you do. And I know you have an appreciation week coming, and you're the reason we all have jobs. So thank you for doing what you do. You guys in some practices may be fielding these initial calls. Do you know what to say? Do you know what to ask? Right? That's really important. If you don't have a checklist at the front stuck to the desk, talk to your team about making one, right? What are the questions you need to ask? How is the patient? Are they breathing? Are they moving? Can you see that their chest is rising and falling? Are they standing? Are they responsive? Are they eating and drinking? Are they having vomiting or diarrhea? What exactly is happening and how long has it been going on? You take these things and you move from there, right? So it's the initial general inquiry. Do you guys know what a signalment is? I hope so. And if you don't, it's something easy and quick to learn. So it's something as easy as saying a 14-year-old FSJRT. That's what you write down because it doesn't take as long. Or if you have iPod things that you text each other or you write in Slack, that is a 14-year-old female spayed Jack Russell Terrier. That is your signalment. You need the age, the sex, and the species, which is going to then talk about what a breed is, right? A DSH is a cat. That would differentiate it that way. And if it's a male neutered MN, things like that. @dove.org has a great acronym chart, especially for shorthand like that. Drugs that they're on, because it's going to matter to us if we can give them certain things. And what's really going on, because they're going to try to tell you everything that's happened and its whole history, but I just want to know why are you here right now? I don't need to know what Fluffy had for last Hanukkah, like on the 7th night, and it was a great time. I'm glad for you that you had that experience, but I want to know why they're vomiting and unresponsive right now. And then you have to write it down, because if you don't, it didn't happen. So it's either in your actual computer record on a piece of paper that gets transferred over, but get that in writing. And then relay it to your vet tech. Or you guys may be taking the call. It depends if that's a different role for you. And I hope all of you that are on here, if you've been in the field as long as I have, sometimes your knees and your backs don't actually forgive all the things that you've done to them over the years. And maybe a different role where you can kind of sit down and field all these calls is something that you can and should do. So if you're taking the call, you're going from that initial intake beyond the signalment and primary complaint into, can you take a look for me? Can you feel their pulses? Can you assess their breathing? Can you tell me how long this has been going on? What other medications are they taking? Get into the nitty gritty of it. Or if you're not taking the call, you get the message and sometimes you have to interpret it. And sometimes you have to go back into the computer and figure it out and call the owner back regardless, right? And that's again, when you get back into the details of it. You can relay your recommendations at this point. If it's something like, yes, we understand that Fluffy has, she's always had these allergies and it's September and the mold and the goldenrod and she's flaring, probably doesn't need to come in at 2 in the morning. We can see her on Monday at 3. And, talk to them about Benadryl in the meantime, because if you don't give them a solution, it's not going to go well for you either. So you need to be able to give them those appropriate recommends. If they can wait, if they need to come in to see you guys, whatever type of facility that is, or if you're slammed and they need to go to a different facility or to an ER that's close by, and then you update your doctors. Doctors, you're not involved in the inquiry process, right? Stay out of the way. But you get the update from us as your vet techs, and then you give us some further recommendations. So that can be part of the conversation with your clients too, is I need to check with Dr. Smith and I'll give you a call right back. Or just hang on for me. I know this is scary, but it's going to be okay. I'm going to talk to Dr. Smith and we'll figure this out together. So that's a little bit of a quick snapshot of what every role within the practice that is involved in the triage can do. And now here's a different version of TPR. And it's backwards. Oh, see, this is why Caitlin always tells me I shouldn't do animations, because then they get all screwed up. And in this case, she was right. Does it feel good to be proven right? So instead of temperature, pressure, and respiration, think of it this way as timing, priority, and response. So how are you going to allocate your time? How are you going to prioritize what needs to be done? And how are you going to respond accordingly? And a response is different than a reaction because it requires thought. So this is where your planning comes into play, okay? So we've talked a little bit about getting ourselves prepared, who's involved in it, getting that new methodology in your head, timing, priority, and response. And let's get some definitions in there because maybe you don't know, right? And sometimes Oxford and Merriam-Webster have really good things for us to learn. So there's triage for you. Really what we're looking to do here is assess who's really urgent and who's not, and prioritize who gets seen, right? So itchy ears, low on the totem pole. Unresponsive, way up there, right? Seizing actively, bumps, right? So everything you have to assess on how critical it is and how life-threatening it is and see them accordingly. Fractures, if they're stable and their vitals are okay, they're not showing any indications of shock, they can wait. And really it depends on what your practice setup is, where they're waiting. Because sometimes if we want to do more of a low stress environment, we can do the initial assessment and then bring them back out to their owners and they can wait in the waiting room or in an exam room. So that way it frees up your time in the back in the treatment area to get things done. Telemedicine is not telehealth, right? You can see that there in that bottom bullet. Telehealth is the broad spectrum, but it also encompasses continuing education and meetings and things, whereas telemedicine is focusing solely on clinical diagnostics and treatment through the phone or a Zoom call, right? So it is what it says it is, remote clinical services via telecommunications. So this is technically telehealth because you're getting medical CE. Ta-da, who knew? But it is not telemedicine. So what we like to coin, I don't think we've coined it, I think AHA did, but that's okay. So you take triage and you add it with telemedicine and it's teletriage. So it's all those questions that we were alluding to earlier, done via the phone by a medical professional. So that's any of us, right? But you got to be careful what you're allowed to do, right? As vet techs, we cannot diagnose, prognose, prescribe, or do surgery, or allude to how this is going to have a overall health outcome, right? So not going to be doing surgery over the phone regardless of who you are, but be careful of giving those medical recommends without a doctor's right there for you. So how is this different? It's obviously there's no physical presence, right? If you're doing this on the phone, there can be this type of interaction and as dynamic as I am. It's not the same as if we were live and able to do these things together, right? I can't physically put a stethoscope on the patient and assess them audibly, but I can see them, right? So traditional, we're there face to face and you can assess the patient in live time, direct relay, it's standard operating procedure, and we're used to it. This is something different, right? Being able to ask these detailed questions, have them put the pet near a video or take a video or a picture and send it in, and you can give recommendations, and it's new. Telemedicine and teletriage as well is not meant to take the place of a live person exam. It's to facilitate the process, right? It's to speed things up, make it more efficient, get all the information, start diagnostics in some cases, right? If they can do like an at-home lab test, if it's something to deal with allergies or a chronic condition that we're monitoring and it's not truly emergent, we can do that at home. There are some companies that will do mail-in orders and things like that for testing kits, but really this is how to start it and to enhance the experience so that the clients feel like, hey, something's happening. I'm talking to someone, I'm seeing them. It's not the same as being there, but at least I've been assured that, hey, they're stable. We need to see them, but it's not emergent versus, okay, this needs to be seen right now, not with us, with another practice, or however it needs to be facilitated. And this is how it works. And this is for either traditional or teletriage, right? You need to get your input and then send it where it needs to go, right? So think about when you're getting a history, talking to a client, these are the things you need to get, right? And I'm not going to go through them line by line because you guys are excellent readers. And hopefully most of you are familiar with this. But really what I want you to focus in is the patient info. That's what we're really caring about. If it's an existing client, should already be in your records. So it's something just to make sure that you're confirming with them that you know who they are. And that's what the output is. The first step is repeat what you got, right? And say to them, you're calling about Fluffy. She ate 3 Rimadyl instead of the half of a tablet she's supposed to get. She's been on it for this amount of time. It happened 2 hours ago, and we need to get you seen. So that's showing them that you were actively paying attention and that you were able to tell them exactly what's going on. The next part of that is you're going to be assessing them. If you are a vet tech. Doctors, you're not necessarily doing this, okay? Remember, this is let your support team do their roles here. CSRs, if you're taking the call, you're going to turf it at this point, right? You're going to send it to the techs to do that verbal assessment on the phone, or you're going to admit them into the lobby and the techs are going to come up and go through this process. So do you guys think you can get a heart rate, respirate rate, assess the mucous membranes, mentation, and ask these couple questions all within 30 seconds? Yeah. You can. It's amazing how long 30 seconds to 60 seconds is when you actually count it out, right? Think about when you're doing CPR. It's the longest 2 minutes of your life, but you get a lot done. So again, you want to repeat the same process, right? On the phone, go through this, right? Go nose to tail and don't miss anything. Is there any ocular discharge? Is there any issues with the ears, any drooling, any type of vomiting? And then you move your way down. And that's again where the recommendations come in. So are you going to be having them take a look at them? Do they need to come into your practice? Do they need to go to another ER? And always, always, always communicate with your doctor, right? So any input that you receive, you need to have the output in 2 directions, back to the client and forward to the rest of the team. And that's our 3 R's, right? I love reduce, reuse, recycle, huge eco nerd here, but a different set, right? Receive, record, and relay. So you're going to get a ton of information, sometimes way more than you asked for, right? But that's where teletriage is also kind of nice too, because you don't have to worry about if the client walks in and it's, oh, just kidding, it's pants optional, or they're having a flea allergy response with their pet and they're like, oh, is that what this rash is? And then the shirt comes up and you're like, ma'am, I work with animals for a reason. But that's where you have to direct the conversation, right? So you have to ask those not leading question, closed-ended, right? Like, how long has this been going on? Start and answer. Are they doing this? Yes or no? And get all that information you need. That second part there, that emotion, that's tricky, right? So those boundaries are in place. Hopefully you're working on those, right? So you don't want to be cold and detached, but you also don't want to take all the emotions that are in that situation and absorb them and make them yours. And especially if it's your favorite, like for me, if it's a Cane Corso puppy, give me a minute. I'll be fine. I love them. They're my breed. I'm not a breedist. I just really like they're mushy and they're big, right? So it's kind of, and they walk on their toes. It's very cute. I digress. But it's really making sure you're aware of what your emotional state is and how you're responding, as well as what that client is feeling. Right? So if we can direct that conversation again and focus it on the facts, like Fluffy's heart rate is really high, she's not breathing well. This is scary, but this is something we see all the time, and we have the tools and the knowledge and the team to take care of it. So reassuring them, not oversharing with them, and keeping them focused on the facts, the medical component, not the emotions, right? We don't need to ask if their kids are coming. We can deal with that when that needs to happen, right? Because that protect piece is for you, because it's not going to be your first or last patient of the day, right? It's always going to be something else. So you need to be able to have that sense of empathy, but not go so far that you lose yourself in it. And that, again, I understand is not easy, but if you keep practicing and saying, okay, this is where my boundaries are, this is how I'm going to ask these questions and how I'm going to direct this conversation, it does get a little bit easier. I can't say this next part enough. Record everything. Another acronym we use in VetMed is CYA. If you don't know what that means, I'm not telling you, but if you don't write it down, it doesn't happen, and not necessarily in ink. Although if you are doing medical records, anesthesia, or what have you, it's got to be in blue or black ink, legal things. But if you're typing it, that's recording as well. And then relaying it. Communication is key. It's one of the skills, because it's been called soft for so many years. Ain't nothing fluffy about dealing with an angry Karen at the front desk. Sorry if any of you were named Karen. My Aunt Karen is really angry that has become a meme, but there's nothing fluffy about that. And when you're in the midst of trying to argue with a doctor about that, you know what's going on and things, that's not a soft skill. It's really challenging, but it's important, right? You need to be able to relay the information back to the client so that they understand that you understand, and it lends that really huge sense of trust and credibility. And also forward to your team. If you're the CSR, it's going to the nurse, the technician. And then if you're the nurse and technician, it's going to the doctor, right? There may be a middleman or woman here or there, but making sure that everyone is in that communication loop. Click, click, there we go. If you're a visual person like me, sometimes these images really help. So get these 3 R's in your brain: receive, record, and relay. All right, and that's what the essence of triage is. Receive that information, record it all down, and relay it forward and backwards so everyone's on the same page. There it is. It's circled in green for you. Why does this matter? All right. If you're doing it on the phone, it's going to save you a little bit differently. But if you're doing this effectively, if your whole team is trained appropriately on how to triage and assess and make sure that things are moving forward, time, energy, resources, oh my gosh. And here's the document on how to do it all. It's not that simple. I wish it was. But you can have those checklists. You can absolutely have the protocols in place and then have someone designated that is running these things. If you have an ER that runs on shifts and you have a shift lead, assign different roles and rotate people through it. When you're training, make sure that you have someone shadowing, right? And they're watching them do it, and then they do it together, and then the trainer watches the trainee, and then the trainee does it solo, right? It's a little bit different than see one, do one, teach one. It's a little bit more involved. It's kind of before you get to that phase, right? It's going to take away from your overhead too, if you're not wasting time on this, and it's going to save your team. If you're not always having the same person running up there and doing this and doing this and doing that because they're good at it. What happens when they take the first PTO they've taken in 3 years and no one else knows what to do? Right? So you have to think of the whole team and the whole picture so you can have all of these things working together. Because when it flows, isn't it nice when you have that set team, when you walk in, you're like, oh, this is going to be a good day. I want that for you all day, every day with every member of your team. And it can happen as long as you have these systems in place, right? If you know what questions to ask, if you know what systems to check, if you understand how the process should work, things flow. Elevate your team to the top of their roles, right? If all of you aren't familiar with Pennsylvania's Veterinary Practice Act, you should be. It will tell you what veterinary assistants can do and what veterinary technicians can do. Doctors just need to be in the building. And there's a lot we can do, right? And remember, only 4 things we can't. Nobody's cutting things open, okay? And we're not going to be prescribing medications. We're going to fill them and we're going to double check the math because that's our job. But what we're focused on is making sure that those patients are stabilized, those clients are happy, and our team is supported. So work up to the top of your position and make things accurate, right? If you don't know an answer, this is not a good time to fake it till you make it. This is, I don't know, I'm going to get someone who does. Because again, that's going to save you face, but it's why are we here? We're here to save those patients' lives. And if I make a mistake, it can have very dire consequences, right? So if you do mess up, fess up. And you should have a supportive team that can get you through it. Because at the end of the day, if you're not psychologically safe, then your patients can't be medically safe. So we've got to take care of each other too. And that's another benefit to this whole process. So have it standardized, do it so you remember it, keep those muscle memories working, and teach each other so you can help each other down the road. And this is what we're going to get into. So what I want you to think of before Caitlin and I put on our little acting gear here, I'm not going to actually change, but it should be fun. I want you to think of it this way: as a CSR or technician that's getting the call, bring it down from a level 10 to a level 3, ask the appropriate questions, take some notes, okay? Techs in this instance are going to be getting the notes. We're going to pick up with the client, keep calming them down because, you know, as soon as they're waiting for 30 seconds, they're going to amp themselves back up. Clarify, 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 make sure they're not talking about, you know, Buddy when they should be talking about Fluffy. And then you give your recommendations. Docs, nobody's, nope, you're not in this kitchen. Nope, I will bring you in when you're needed. Right now you're not. But in this situation, we're going to just pretend that they're there because they need to be legally for us to be practicing. They're going to get the updates from the technicians. Then they're going to give their recommendations and confer with the team. But sometimes we don't need you. We can figure this out on our own. So we have 3 different scenarios. We've kind of picked one that we think would be the most beneficial. But I want you guys to take a look at all of these too. And I know it can feel silly to go through and like pretend that something's happening when it's not. But if you don't practice it when it's not an emergent situation, your brain isn't going to know what to do when it is. That's why emergency for me is so rewarding, because I don't have to think. I go into instinct mode and I can just go, 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 go. You know, of course, pending how much caffeine and food I've actually had that day. So I think, what did we decide on? I think we're going to go with the third scenario. None of these are good, right? And we're not looking to like, it's not going to be a feel good scenario situation, but it's something that I'm sure all of you have had in some shape or form one of these. A long-term client doesn't have to be internal medicine, but if those of you working in specialty can appreciate the in-depth and sometimes hand-holding that is required of these long-term cases. But angry clients that have, itchy and ear issues, and it's a problem at 6 o'clock on a Friday night. But the third one, this one can be really challenging. When someone doesn't have a history of being with you guys, they're brand new, they don't have a lot of money, and it's a brand new puppy, and it's not doing well. So shall we go? I think we're going to do that. I'm going to be the vet tech, and Caitlin has so kindly volunteered to be the client that I'm going to be working with. So this puppy is going to be 10 weeks old, and it was bought from a pet store, which makes everybody happy, right? Everyone on the webinar is like, yay, pet store puppy. It means that if we're in Pennsylvania, it's probably from a puppy mill. That's fantastic. Doing great. What the breeder said that they had all their vaccines, so we didn't get it. We've never been to a vet, right? And we got a puppy, but we don't have a lot of money because we spent $3,400 on a designer mat. Not judging, I'm just saying it happens. So
I feel like I've made some bad decisions here as the client.
you have not thought this through well. All right. So I will let you decide, Caitlin, how your mentality and how you're going to approach this is. And I'm going to do the best I can to assess your puppy and to talk you through what we need to do. All right. And action.
Bring.
Thank you for calling EVT. This is Alyssa speaking. How may I help you?
Hi, yeah. I got a new puppy this past weekend, and she just really is not responding, and I'm a little worried. I'm not sure how worried I should be, but
okay.
I came up to my sister. She said you guys are the best, and so I wanted to call and see what I should be doing. Should I be coming in? Should I stay home?
Okay. Well, first of all, congratulations. You got a new fur baby member of your family. What's her name?
Tallulah.
Tallulah. Oh, I love that. That's so sweet. And do you what kind of dog is she?
She's a golden doodle.
Oh, super cute. Like a full size, or is she one of the mini ones?
I think she's going to be full size.
Okay, they weren't really sure. Okay, was it from a breeder? Where did you get her last weekend? Where'd she come from?
I was in the mall, and they had the puppies out at the pet store. And she was just so adorable, and I couldn't
hard to resist. Yeah, and you said you just brought her home last weekend, right? Is this your first dog? Have you ever had a puppy before?
No, this is my first dog. I'm in my first apartment on my own, and
oh wow. Okay, so pet deposit. Be careful of that. All right. So you said she's not responding when you say Tallulah. She's just kind of laying there. Is that what's happening?
She's just kind of laying there. She like flutters her eyes open, but they don't stay open long.
Okay. Has she been eating and drinking?
I think she ate last night. I don't think she touched her food this morning.
Okay. Any vomiting or diarrhea?
Not that I've seen.
Okay, well, that's good. You would notice. Hopefully you haven't stepped in anything, because that would be unpleasant for both of your sakes. Okay. Do you happen to know when you got her at the store, did they give you any records on her that she's had any vaccines or a physical exam?
They didn't give me anything, but they told me she did.
Okay. And has she been outside of your house, or has she just been home with you until today?
She's just been home since we got her.
Okay. And do you know about how old she is?
They said she's about 10 weeks.
Okay. All right. So sounds like we need to take a look at her. I can't really assess her on the phone. And I am, just so you know, I'm one of the vet techs here at EVT. So I can talk you through this. I do have my medical license, but a doctor needs to see her. So how far away are you from us?
I'm about 30 minutes.
Okay. And did they talk to you about pet insurance? Did you talk to anybody about that?
I haven't done any of that. I just kind of bought her on a whim.
Oh, you know what? We all do that. It's a little different than when you get a brand new pair of shoes, though, and that's okay. We're going to talk you through it. So just so you know, the exam fee will be about $150, and then we'll likely need to run some tests from there. However, we understand that a puppy it's a big investment, right? So we'll have one of the gals at the front desk. We have a couple different payment options. We have scratch pay, and we also have care credit. And I would love to tell you more details about that, but I really want to make sure that you can get here and we can take care of her. So are you comfortable with talking to one of our receptionists about those different finance options when you arrive?
Yeah, I think so. I kind of spent all my money on her, so
Okay.
it's gonna be an issue.
All right, well, we're going to talk you through it and they're going to be able to figure out something for you. The biggest thing is we need to get her seen either, if not here with us, she needs to go to a vet and we're the closest one. And we do have all of the things that we can to take care of her here. So just so you know, excuse me, that Care Credit is a medical credit card. There's 0 interest. I know that much for the first 6 months and they can talk to you about that. And we'll do everything we can to keep the bill as low as we can, but we need to see her to make sure that we can get her feeling better. Okay.
Okay, I'll head in.
Okay, we'll see you soon. Thank you so much. Okay. That ended fairly well because I knew it had to. But it's something really, what I'd like you to take away from that is making sure that you own the humanity in the situation. You know, recognize that we've all made decisions sometimes that we regret. And this is not a place of judgment. This is, we are focused on making sure that in this case, Tallulah can be seen and been taken care of, right? So we're not going to say to them, well, why did you do that? And even though maybe sometimes in our head we're thinking it, that we've got to be careful of that knowledge bias, right? Like we know better, but the general person does not, right? They don't know that a golden doodle is not its own breed, right? They don't understand that there aren't the same breeding standards from the pet stores versus a heritage breeder or things like that. And to focus them on, like, we understand that this is a lot of money and hopefully your practices do have these options and you can talk to them about Care Credit or scratch pay. Payment plans, I'm not going to go there with a 10-foot pole. That's something that your management has to decide and that's not my area of expertise, but it's something to consider, right? We've all heard those stories of like, we're in it for the money. It's like, really? Are we? No, we know that. But it's making sure that they understand that this is not and which I did not actually do an excellent job of conveying, is like, this is the same as if a human was sick, right? This is your new little baby and we are here to provide that same level of care. I need you to understand that this is an emergent situation and we need to take care of them. So the other scenarios that you see there, similar thing, and switch the roles up, right? I won't torture Caitlin like that because she's had 3 years of veterinary experience, all of them with us. So that would not be fair to put her in that role. However, switch that up with your team, right? And practice these things and go over actual things that have happened so you can revisit them. So what happens when that unresponsive patient is really not responding? Okay. Think about Recover. If you have not looked into these courses, I would highly encourage you to do so. I believe they're actually doing a bit of a discount now for Vet Tech Week. So now is a good time to do it. Do your basic, your BLS and your ALS, basic life support, and then your advanced life support. And what it's going to talk to you about is all of these bullet points and a bunch more, right? This is really just to give you a little snapshot of what to remember, that this is a team-based approach. You're going to have your team leader directing all of you with what to do. And no, this should not be a veterinarian. Surprise. You guys as vet techs should be doing this, okay? Because our doctors are in charge at this point of making the overall medical decision if we continue or desist with the CPR and contacting the client. That's not on us. So we need to be running the code, right? And then the compressor, the ventilator, the drug handler. I kind of miss, they used to call it drug pusher, but apparently that's got a negative connotation. So, and then the recorder that again writes everything down. You'll notice under the equipment section, you don't need much, okay? Remember, if the heart ain't pumping, there's no pressure to read. So your pulse ox and your blood pressure, no use. So what you need is your ECG to see which rhythm you're dealing with, if you have one, and a capnograph. So if you don't have that piece of equipment in your practice, talk to your purchasing director, your office manager, and say, this is really important, because it is. And then you get into the compressions. Make sure that it's not what you see on Grey's Anatomy, because that's never effective. No wonder they never come back. It's a full body workout. Arms are locked and you're literally bending from the waist. 100 to 120 beats per minute. So count it out loud. If you're a singer like me, then go for it. Unfortunately, the most accurate one is another one bites the dust, which is unfortunate words, but we also know, those of us that have done this before, that sometimes, that more often than not, that is unfortunately the case. However, if you needed to do 120 beats per minute, you can do Just Dance by Lady Gaga, which is actually 118. It's perfect for cats and small dogs. Cardiac pump theory versus thoracic pump theory, where you put your hands on the chest, pushing directly on the heart or at the highest point to create that intrathoracic pressure. 1 breath every 10 seconds. No, that is not true. 1 breath every 6 seconds, which correlates to 10 breaths per minute. Forgive the ratio, but it is 1 breath every 6 seconds equaling 10 breaths per minute. Apologize for that error there. And watch your end tidal, because that's really going to tell you if you are actually doing excellent perfusion with the gas exchange at the lungs. Epinatropine are your go-to drugs, and Recover has these lovely algorithms and drug charts. You don't have to remember anything, right? Remember I said you don't want to think too much? And those of you that don't have defibrillators, it's okay. You can do a windmill and bang them on the chest and get it restarted. I have literally seen a cardiologist who is all of 5'1" come flying across the treatment room and bang a Labrador on the chest, and by golly, that dog's heart started beating again. It can work as long as you know what you're doing and where to hit. For a cat, you don't want to do the whole roundhouse. You want to just do a little bop. The closed loop communication is making sure that that team leader is directing it to each of the team members and they're repeating it back. So you understand and you can reiterate what's being said and it's getting done. And then at the end of it, you come together, whether it's a positive outcome or not, to talk about how it went. Don't feed each other crap sandwiches, right? Like, this was really good. This was really bad. Overall, good job. This is the constructive criticism time. Like, we really got a good response time. I wish we could have done this a little bit differently, like spoken a little bit louder and be more clear. And I think next time what we should focus on is this. Give yourself the grace to learn from one another and the ability to improve for the next time, because I can guarantee you there will be a next time. My goodness, we covered a lot in 54 minutes. And really what I want you to keep in place in your brains is that effective triage works, whether it's on the phone or in person. Keeping that new TPR, right? Timing, priority, and response in the forefront of your brain, along with the 3 R's, receive, record, and relay, is going to save you a lot of time and effort and energy. Know and slow your roll. And what I mean by that is you don't want to rush. Know where you're headed and what you're doing, and don't cross paths. Let people work to the highest capacity that they can. Set those high expectations and then help people get to where they need to be, because they can do it. Stick to the process. If you have things written down, don't deviate. It's like if you put things into Google Maps and you're like, oh, but this way looks better. Don't do that because then you're going to end up on the wrong side of the turnpike. In this case, always, 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 every patient, every time, do it the same way so you don't forget and your muscle memory kicks in. But this is medicine. It is a practice. It is an art. So every once in a while, you're going to have to revisit it, rework it, and change it, because cats are not small dogs and Chihuahuas are not Great Danes. You're going to have to revamp what you're doing, especially depending on who's your shift on who is on your shift. Keep those memory muscles sharp and review these things and play those roles. You're going to feel silly, but when it comes time for the real deal, you're going to be ready. Thank you guys for hanging out with us on a Tuesday night in the middle of Tech Week. It started on Sunday because a lot of you guys work on the weekends. If you have any questions that we'll actually going to take some time here in just a second to go through them. But this is our email. It will get to a live person and one of our team will get back to you. And these are all of our social handles as well as our website. And we'd love to hear from you. So I'm going to stop talking for a second and see if there are any questions from anybody else. And then we will wrap it up in the next 5 to 10 minutes. Thank you so much, everyone.
Liz, we just had a couple. The first one probably takes a little bit more to answer. At what point do you bring in the veterinarian when you have an irate client, but their patients in the ER or their pets in the ER?
That is an excellent question. It depends on how your structure is set up, right? Your hierarchy of, how you escalate situations like that. First thing I would do is get that pet parent into an exam room. Definitely don't want to have any of this happening in your waiting area. And then see if you have a shift lead that can talk to them. And if not that, then a manager. And then ultimately, then you bring the doc in when you aren't feeling safe and you're feeling that you can't adequately answer the questions that they're asking and de-escalate that situation, even if you tried everything, right? So take it up the tiers if you have that capability to go to your shift lead or supervisor and then a manager and then the doctor. But if you don't, and it's time for you to tap out, recognize it in yourself, and it's okay to be like, hey, this is beyond where I can be. Can you please go in and talk with them? And they should back you up to do so. Great question.
Thank you. I have to scroll back up to the other one. This one's more direct. Do you know of an over-the-counter ointment, cream, spray that works against both bacteria and yeast?
Thank you so much for choosing to be a part of this conversation today.
Whoa, I don't know what happened there. Sorry about that. I don't, off the top of my head, it really depends on, there's a couple different dermatological ones. And I can see the bottle and I can see the colors. It's silver with red, and I'm not entirely sure what that title is. So I don't really feel comfortable giving you a recommend because I don't want to get it wrong. But it's definitely something that you could probably look up on Clinician's Brief or one of those other websites that could give you a better answer than I could.
Okay. And I'm wondering if this is the same question we got in two ways. I don't know the details enough, but in OTC.
I'm so sorry. I'm not sure what's happening with the volume there. Go ahead.
That's similar to Animax.
I loved Animax. That was one of my favorite ones. There's like Panalog, I think, Panalog cream. But again, I haven't used topicals in a long time, so I don't want to give you misinformation. So sorry, I'm not the good medication guru.
That's all right. Maybe if some other folks in the chat know, they can throw it out there. Okay, this is another good one and one of our scenarios, but the client thinks it's super urgent and they are demanding to be seen, and the staff knows this is nowhere near urgent. How do you suggest handling that?
Okay, that's a great one. And it really depends on what like the urgent thing is, right? Like definitely have had it ranging from like they're itchy to they're just, well, you know, they smell funny, right? So it can be what is the sense of severity there? So really what I tend to do is I can say, well, you can't see a doctor today, is a tech appointment an option? Go through what an actual emergent thing is and have them walk through it with you. And be like, okay, can you feel their heart rate for me? Like make them do it with you. Like check their respiratory rate, heart rate's normal, their gum color is normal, they're walking around, they're eating, they're drinking, they haven't had any issues eliminating. Great. So overall they're stable. They just have this really pressing, like their ears are really itchy. And I understand that's uncomfortable. If they've been there a long time and you have this as like an ongoing thing, you can be like, this is what you've done before. We haven't seen you in a year, so we can't prescribe any antibiotics, even though, you know, they're like, well, we know that's what it is. Understand, but legally we cannot. So then I'm going to confirm with the doctor. You already know what the Benadryl dose is, but say, I need to confirm with the doctor before I tell you what it is. And then give them 30 seconds to just cool off and hop back on and say, this is what you can do over the counter until we can get you in to be seen. So a couple options there. If there's a tech appointment, great. If there's not, literally walk through that triage process so you can prove to them that their pet is stable, and then see if there's something over the counter that they can do at home in the interim.
That's it. You've answered all the questions.
Well, thank you guys. I know there's a couple other slides. I'm going to keep trying to make this work. There we go. I got through to the next one. So sorry, there was some audio on there. Make sure that you hang out with some other events that are coming up, and I'm going to let Carly tell you more about those.
Awesome. That was great, Alyssa. Thank you. And thank you, Caitlin. I think you did a wonderful job playing the new puppy parent. So good job on that. Lots of great sentiments in the chat. People are loving the presentation. So thank you again, Alyssa. That was awesome. Especially like we said earlier during Vet Tech Week, we wanted this to be something that really hit home with vet techs, our gift, if you will, to you guys. So again, great presentation. I have put in the chat a couple of times a link to for everyone to earn to get their CE certificate. So if you fill out the form at that link, we will make sure to get those submissions over to Alyssa and Kate at EVT, and they'll get those certificates out to you within the next couple weeks. So I will drop that in the chat again. It is a JOT form that you're going to be redirected to. So you can just fill that out in its entirety, and we'll get that CE to you in a couple weeks, like I said. We would love for you to join us again next week. if you feel so inclined, we are doing another VetFuel we're partnering with Boehringer Ingelheim for this one with Jack Carson. He works for South Beach Veterinary Solutions, and he'll be talking about maximizing the potential and value of your veterinary practice. So really geared toward practice owners, but sometimes we have vet techs, practice managers that have a stake in their vet practice, or they want to talk to their owner about, hey, CVP is amazing. I want to join that community. Let's go to this webinar and see what they're all about. So that's what we have coming up next week. And we also have our November VetFuel scheduled as well for November 15th at 7 p.m. Eastern time as well. And that is with Purina Pro Plan Veterinary Diets. And we'll be talking with Dr. Michael Lappin about clinical research experience with probiotics. So that should be a great one as well. And that's going to round out our VetFuels for the year, which is exciting. We're working on a great calendar for next year. We're going to have some good ones coming up. Hoping to partner with EVT again next year, because these are always super popular, and people come because they love your presentations, your presentation style. So we really appreciate that. And just a quick closing note about CVP. We are a community of veterinary care professionals, and when veterinary professionals and the team members that support them have what they need to thrive, pets thrive too. And CVP is building a community that provides extraordinary care for all its members, no matter how many legs or wings they may have. We know what is important to people, and making sure they have what they need so they can focus on delivering great care is our priority. So if you're interested in learning about the careers within our community, you can visit cvpco.com/careers. And if you're interested in joining our community via acquisition, you can visit cvpco.com/partners. And with that, I am going to close this out and give another big thank you to Alyssa and Kate.